Andrew, maybe I can start with you. You've been a patient for quite some time now. What do you think about this concept?
So I think probably my answer, I could probably split into three sections. One's to do with convenience. I think the other's to do with the physical experience of it. And then the last part would be to do with efficacy, which I'd be interested to get some answers on. From a convenience point of view, so I've had my condition for 20 years. It took about 5 years to get diagnosed, and then I've been under the care of the Royal National Throat, Nose and Ear Hospital in London for the last 15 years, and they do a great job. I take a cocktail of medicines every day that keeps my condition in check, but sadly I have to top it up with steroids a few times a year, which I know there are long-term risks for. And then every now and again I'll have an operation. And I'm due to have an operation in October, November time, which will come on to my first point of convenience. I don't know exactly when that operation will be. We're in September at the moment. I know that it's a general anaesthetic, and it'll be roughly 2 weeks of my life that I need to take out before I'm fully back to work. I run my own business, so I won't find out until 2 weeks beforehand when that operation will be, and I can't imagine anybody sat here today in 2 weeks' time can just take 2 weeks off from their lives. So I understand the NHS is brilliant, the hospital's brilliant, but people are busy and I need to be fitted in. So if this were more convenient, then that would be appealing. The second part, the physical experience of it, under a general anaesthetic, I'm asleep. So you can kind of do whatever and I won't be there and lucid whilst it's happening. What do I feel about being awake whilst it's happening? I don't know is the honest answer. My toes are currently curling, so that might give you an idea. But I liked your analogy about dentistry. I've had a filling this year, so I know actually it isn't as bad as I thought it would be. And then my last part really would be to do with efficacy. Is it more or less efficacious than having my nasal polyps removed under general anaesthetic? Would I have to have 3 of these for just one of those surgeries? So I think it's really interesting, and I think I've got some benefits from it I can see, and that definitely appealed to me, but a few reservations as to what it might happen.
Dr. Carrie, maybe a short response?
Yeah. So I think, those are very valid points, and they're the sort of points that all our patients would raise in this case. A lot of it goes back to individual patient selection. And so as an asthmatic with nasal polyps, you wouldn't necessarily be my first choice to offer this particular procedure to. But having said that, if you've had surgeries previously, in which case you will have, I suspect, quite a bit of the internal nasal sinus anatomy already removed, and you have polyp recurrence occurring in a cavity that's easy to access, this may be a procedure that might be suitable for you, and your own surgeon would know that. As a surgeon myself, I can generally get some idea of whether a patient's going to be a good candidate to have this done from a comfort perspective in clinic, because there are many patients who are actually reasonably happy to have a 4mm telescope put up their nose in clinic without too much concern, sometimes without any local anaesthetic. Others will, as soon as you put a telescope to them, they recoil. So almost immediately you get some feel for an individual's perception of anaesthetic. And while your experience is such that the thought of a local anaesthetic makes your toes curl, quite a few of our patients are the other way around. The thought of a general anaesthetic makes their toes curl. And they've had knee replacements under spinal anaesthesia. They've had major operations under non-general anaesthetic situations, which tips the balance in a slightly different way for them.
And as far as, if I can ask, as far as the mechanics of how it works, is it the same as the general anaesthetic operation? Are you going in and clearing the majority of the polyps out?
So one of the main procedures that we undertake is the removal of nasal polyps, yes. And we use the same sort of instruments that we would use in the general anaesthetic, but we use smaller instrumentation. So our telescope is smaller, and our instrument for removing the polyps is correspondingly smaller as well.